topic, cleft lip and cleft palate. So, what is the cleft lip? Cleft lip is a congenital appearance where there is an opening in the upper lip. So, congenital appearance means when baby in the mother's womb and organ development is occur. So, when baby is growing in the mother womb and baby's lip is formation is occur, but when there is an opening in the baby's lip, baby's upper lip, that is called the cleft lip. Generally, complete lip formations occur 5 to 12 weeks of gestation. But due to various etiological factors, during 5 to 12 weeks of gestations, lip is completely not formed and occur a opening in the upper lip, that is called the cleft lip. Next, what is cleft palate? Cleft palate is also a congenital appearance and it present opening exit in either the hard or the soft palate or both. And these hard and soft palate formations occur 12 to 14 week of gestations. So, during 12 to 14 week of gestations, when the baby's hard and soft palate is not completely formed or an opening is present in hard and soft palate, this is called the cleft palate. All are understood? This is the cleft lip and this is the cleft palate. Now I discuss how the cleft lip and cleft palate is formed. Before knowing how the cleft lip and cleft palate is formed, we should have to know the 4 things that are the frontonasal process, maxillary process, mandibular process and the nasal process. So let's discuss about this formation. This 4 process is being started. The formation of face is start and the formations of face is start at the 4th week of gestation. In the 4th week of gestation, embryo structure is this. This part is frontal prominence. This is the stomodinum and features of the mouth. Stomodinum is the features of the mouth. And these are the cardiac bulbs and 5 pair of pharyngeal arc that is located the lateral side of the stomodinum. This is the stomodinum and this is the lateral side. So, the 5 pairs of pharyngeal arcs located lateral side of stomodinum. At the end of 4th week, 2 localized epithelium thickening appear on the lateral side of the frontal prominence. This is the frontal prominence and this is the lateral side, and the lateral side of the frontal prominence there is 2 localized epithelium thickening is appear. This is the epithelium thickening and this epithelium thickening is called the nasal placard. And this nasal placard formed the nasal pit and few days after this nasal pit is formed the nostril. In the 4th week of gestation, nostril is formed and around the nostril, this is the nasal process. And the medial side of this nasal process, this is called the medial nasal process. And the lateral side of the nasal process, this is called the lateral side of nasal process. And this is the maxillary process and this is the mandibular process. And in 7 to 8 weeks, these 2 medial nasal process are fused and formed the middle portions of the upper lip along with the primary palate. So, after the fusions of this medial nasal process, middle portions of the upper lip is formed and primary palate is also formed. And when this medial nasal process also fused with this maxillary process, the lateral side of the lip is formed. And primary palate is formed after the fuse between this medial nasal process and this primary palate. When it extended from the maxillary process, secondary palate is also formed. All are understood about the formations of the lip and palate. Repeatedly, I discuss about this, the formations of lip and palate, because it is very important for the understanding of cleft lip and cleft palate. So, in the 5th week of gestation, there is a medial nasal process, lateral nasal process, nostril, maxillary process, mandibular process is formed. And during the 7 to 8 week of gestation, fusion between the medial nasal process the formations of the middle portions of lip and primary palate. And when the medial nasal process also fuse this maxillary process, what is formation is occurred? Lateral side of lip. And when the primary palate is extended to the maxillary process, secondary palate is formed. I discuss about the normal formation process of the lip and palate. And when, due to the various etiological factors during the embryo development, the fusion is not occur properly, cleft lip and cleft palate is occurred. Show in details if the cleft lip is medial, show there is disturb between the fusion of two medial nasal process. So, if the cleft lips occur on side, so there is disturb between the fusions of medial nasal process and maxillary process. And when the failure of fusion between two palatine slits, that are the primary palate and secondary palate. Failure of fusion between two palatine slits means when the primary palate is not extended to the maxillary process and secondary palate is not formed. Due to this result, the formations of cleft palate. This is all about what is cleft lip and cleft palate and the formations of cleft lip and cleft palate. Next video, I will discuss about the etiological factor, clinical features, types and complications and also the management of cleft lip and cleft palate. Thank you. To get benefit from my channel, please subscribe, like and share.